No teníamos smartphones, pero teníamos radio y vivíamos en los 80s.
nunca supiste ni cómo empezar. Y yo debí estar loca, que ciegamente hacía lo que tú me decías y no me daba cuenta que has usado mi vida solo a tu favor. Entre tú y yo no hay nada, no queda nada, solo la esperanza que todo cambiará. Entre tú y yo no hay nada, no queda nada, solo la esperanza que fueras diferente y me quieres llenar la cabeza de locuras nuevas para distraerme y ya no queda mucho de mi juventud. Cuando te quedes solo vas a pedir por ti, pues solo yo he aguantado tus caprichos de años y ni todos los santos te van a salvar. Entre tú y yo no hay nada, no queda nada, solo la esperanza que todo cambiará. Entre tú y yo no hay nada, no queda nada, solo la esperanza que fueras diferente. Si decides poner la marcha atrás y volver al punto de comienzo, creo todavía estás a tiempo. Devuélveme el lugar que le cediste a ella. Entre tú y yo no hay nada, no queda nada, solo la esperanza que todo cambiará. Entre tú y yo no hay nada, nunca hubo nada, solo la esperanza que fuera diferente. Entre tú y yo no hay nada, no queda nada, solo la esperanza que todo cambiará. Entre tú y yo no hay nada, no queda nada, solo la esperanza que fuera diferente. Entre tú y yo no hay nada, 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 solo la esperanza que todo cambiará. Entre tú y yo no, 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 solo la esperanza que fuera diferente.
En Cuba, los 80s sonaban así.
We started dancing and love put us into a groove. As soon as we started to move,
Star Trek.
Not a toy he wants this holiday.
Nice clothes, not on her list.
What these kids want, your kids have. Their health.
At St. Jude Children's Research Hospital, we're fighting for kids who aren't as lucky as yours.
The discovery that St. Jude can help save children close to you.
Our treatments are used in hospitals all across America.
Thanks to our research, St. Jude has the world's best survival rates for the toughest childhood cancers.
And no family ever pays St. Jude for anything.
Our discoveries today could save a child you know tomorrow. So if you have healthy children, give thanks.
Give thanks.
Dadas gracias.
Give thanks.
Donate now or visit stjude.org.
He should be fighting video villains, not fighting for his life.
At St. Jude Children's Research Hospital, we're battling for kids who aren't as healthy as yours.
Our research has changed how the world treats leukemia, brain tumors, and sickle cell disease.
And no family ever pays St. Jude for anything.
Our discoveries today could save a child you know tomorrow.
Go to stjude.org or shop.
Nolan had a brain tumor.
The following message was filmed 2 days before the death of Danny Thomas. It is being aired with his family's permission.
There are some words a child should never learn.
I had rhabdomyosarcoma. When they did the biopsy, they said it was 99% sure it was osteosarcoma. I had acute lymphocytic leukemia.
These are the words of children with cancer. They're in a race against time, and even at their age, they know it. There's reason for hope at St. Jude Children's Research Hospital, one of the world's foremost centers for research and treatment of childhood diseases.
Hi, I'm Danny Thomas. The valuable work at St. Jude is saving so many lives, and with your help, we can save even more. By contributing just $16 a month, you can become a St. Jude Partner in Hope and help a child through their treatments, or help a parent travel to St. Jude to be with their child.
Kind of bother. I spelled it wrong. Spør
Can Bosley regrow your hair?
This is my own growing hair that I can comb, cut, style, do whatever I want with it.
The results I've achieved have been exceptional. This is my real hair. I can do with it whatever I want. This is mine.
Bosley gave me my hair back. I cut this hair. I wash this hair. I mess this hair up if I want to mess this hair up.
I can't explain to you the way that it made me feel to be able to wear my hair down, go out on a date, and have confidence again.
Can Bosley regrow your hair?
This is my hair. This is my hair.
Call or go online for your free
In order to achieve the most natural hairline, we first take measurements to use as our guide. We then trim the hair on the rear of your head to create a donor area, where we will harvest good, healthy hair to be used in the transplantation process. Before the procedure begins, we administer local anesthesia just under the skin in this area. Once the donor area is prepped, we'll recline you comfortably in position and begin the process. We'll start by extracting individual grafts, or follicular units, from the donor area. We then separate the grafts into categories, based on the number of hairs in each graft, each with a specific purpose. While the follicles are being prepared by our team of technicians, we'll begin preparing you for the transplant process. The doctor will begin by creating a natural hairline, by making tiny recipient sites for each new graft to take root.
Guys, got hair look?
Welcome to MD Anderson. The goal...
If chemotherapy or chemo has been recommended...
Welcome to the Chemotherapy Basics course. Our goal is to help you learn about your treatment and understand how you may partner in your care. This course is designed to help you understand basic knowledge about chemotherapy and the possible side effects you may experience. Your nurse and doctor will have additional information when you are seen in the doctor's office. Please ask any and all questions you may have. Every question is important to you and to us. With this information, we hope you have a better understanding of what you can do to help manage possible side effects. Your healthcare team is here to help you. We are on this journey with you. Chemotherapy, or chemo, is used to describe the medications that kill cancer cells directly. Most frequently, chemo is given by intravenous line. It may also be a pill that is taken at home by mouth. Other medications that may be a part of your treatment are biologic therapy, monoclonal therapy, targeted therapy, and hormonal therapy. The medications work differently and have different effects. For our discussions in chemotherapy basics, we will refer to all anti-cancer medications as chemo or chemotherapy. Not all chemotherapy medications work in all types of cancer. Drugs may be given as a single medication or may be given in combination with other medications. The regimen may be either a single day or up to 5 days in a row. Some IV chemotherapy requires placement of a port. A port is a device approximately the size of a quarter that is implanted under the skin by a surgeon. The device uses a special needle that nurses can use for chemotherapy, blood draws, and IV fluids. A port may stay in place for months or even years. As with most medications, chemotherapy drugs may have side effects. Side effects are the unintended actions that occur as a direct result of taking medication. Not all chemotherapy causes all side effects. Chemo does not cause side effects in everyone. Different people may have different reactions. It is important to remember the severity of the side effect does not indicate the effectiveness of the treatment. Most side effects are temporary.
At OSF Healthcare. Hi, I'm Kathy with Level Up RN. In this video, I'm going to talk about irritable bowel syndrome as well as an abdominal hernia. At the end of the video, I'm going to give you guys a little quiz to test your knowledge of some of the key points I'll be covering in this video, so definitely stay tuned for that. And if you have our Level Up RN medical surgical nursing flashcards, definitely pull those out so you can follow along with me. First up, we have irritable bowel syndrome, or IBS, which is an intestinal disorder that causes abdominal pain and changes in bowel movements in the absence of other disorders. So the pathophysiology behind IBS is unknown, but risk factors can include stress, mental health disorders, intestinal bacterial overgrowth, as well as food sensitivities. Signs and symptoms can include abdominal pain, diarrhea, constipation, or a combination of both diarrhea and constipation. And then patients often report improvement in symptoms upon defecation. So in terms of diagnosis, we usually ask the patient to keep a food symptom journal in order to identify triggers of their symptoms. So foods that sometimes trigger these symptoms include milk, alcohol, caffeine, wheat, or eggs. In addition, we would need to do diagnostic testing to rule out other disorders. So this would include blood tests and stool tests. In terms of treatment, two key medications that would be used in the treatment of IBS include allocetrone, which is used for IBS with diarrhea, and lubiprostone, which is used for IBS with constipation. In terms of patient teaching, in addition to keeping that symptom food journal, we want the patient to increase their fiber intake, increase their physical activity, avoid gluten, and reduce stress if possible. Next, we have an abdominal hernia, which is where a section of the intestine protrudes through a weakness in the abdominal wall. So you can have an umbilical hernia, which happens over the belly button, or an inguinal hernia, which happens around the groin area. So the pathophysiology behind this disorder is that we have muscle weakness and/or increased intra-abdominal pressure that allows for that herniation. So when I was pregnant with my second child, I ended up with an umbilical hernia. So before getting pregnant, I had a laparoscopic surgery in my abdomen, and they closed my abdomen up, but by opening and closing my abdomen, it created a weakness in my abdominal wall. Then when I got pregnant, that obviously caused increased intra-abdominal pressure. And that's how I ended up with that umbilical hernia. So when that portion of the intestine protrudes through the abdominal wall, it can get caught and strangulated. And that in turn can cause obstruction of the bowel and bowel necrosis. So it can be very dangerous. In terms of risk factors associated with an abdominal hernia, those include obesity, pregnancy, which was my issue, as well as lifting of heavy objects. In terms of signs and symptoms, those include a lump or protrusion at the affected site. So when I was pregnant, I had this huge belly button that was sticking out, and I thought, oh, I guess I have an outie belly button while I'm pregnant, but no, it turned out it was a hernia. In addition, if we end up with strangulation of that bowel, that can cause severe pain and decreased bowel sounds when we have that strangulation or obstruction. In terms of treatment, the patient can be given what's called a truss, which is like a belt that holds the protruding tissue in place. We can also do a surgical repair of the hernia, which is what I had after I gave birth. And then if we end up with strangulation of the bowel, that may require a bowel resection, so removal of part of the bowel. In terms of patient teaching following a hernia repair, we want to advise the patient to avoid coughing, and if they need to cough or sneeze, they should splint the area. In addition, they should avoid heavy lifting and straining. All right, it's time for a quiz. I have 3.
In this video, I am going.
Once your digestive system is compromised and you have IBS,
Hey guys, Dr. Houlihan here again. Today I'm going to be talking to you guys about 5 different things you can implement into your diet and lifestyle that can help alleviate symptoms of Crohn's, inflammatory bowel disease, and irritable bowel syndrome. Now I have a couple disclaimers. First of all, I'm not a medical doctor or a registered dietitian. I don't have any advanced degrees in nutritional sciences, so you should consult a credentialed professional if you're looking for recommendations that are more specific for you. These 5 things, while substantiated by the research, anecdotally, they have worked for me, but they may not work for every single person. So if you need more specific
You're supposed to poop once a day.
Today's topic is difference between IBS and IBD. IBS, irritable bowel syndrome, or IBS, is the term for symptoms that happen when the contents of your large intestine move too quickly or too slowly. People with IBS show no clinical signs of a disease and often have normal test results. Symptoms. IBS is characterized by a combination of abdominal pain, cramps, constipation, diarrhea, urgent bowel movement. Causes. The cause of IBS is not known for certain, but the following conditions are thought to increase your risk. Bacterial infections in the intestines or colon, food intolerances and sensitivities, genetics, with a family history of IBS, mood disorders such as depression and anxiety, pain location. Types and locations of IBS pain often include upper abdomen. This pain may get worse after eating and is often accompanied by bloating. Middle abdomen. This pain centers in the belly area and is often felt as cramping. Lower abdomen. This pain usually decreases after a bowel movement. People with IBS report different types of pain, including cramping, sharp or stabbing, aching, throbbing. Pain associated with IBS includes both visceral pains.
Hello, and welcome to Zoe Shorts, the bite-sized podcast where we discuss.